Welcome everybody to this month's Comagine Health Patient Family Partnership Hub meeting. Hope you all had a good last month. Just a few Zoom things, just in case you need it. We have the chat is down in your menu bar. You can private message someone by just clicking where it says everyone, and you can click that person's name you want to chat on the side. I've turned on the live transcript, or I've enabled it, and if you would like to use it, there is the CC down at your menu bar as well, and you can just click on that and it'll turn on the live transcript for you. And if you have any questions or would like to say any comments, you are more than welcome to. There's a couple options. You can click the reactions button, click raise hand, and we'll call on you, or you are more than welcome to add comments and questions in the chat throughout the meeting as well. And I'll pass it off to Katie for this one.
Hello, everyone. Welcome to our monthly meeting. As a reminder, this is the mission for Comagine Health. Together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish.
Thank you. Thanks, Katie. And this is PFCC Partners mission, vision, and values. Our mission is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. Our vision is a health system transformed, one that works with people and through communities as a partner in their well-being. Our values are equity, inclusion, diversity, collaboration, and solution focused. And of course, this is the Patient Family Partnership Hub, where patient family partners from all around the Comagine states and facilities come together. This is one part of the hub. This is our monthly meeting. We also have the community forums on the PFA network website, skills development opportunities, your existing PFACs, engagement opportunities, and other PFCC events. This is today's agenda. We are mainly doing the intervention logic models. We are going to talk a little bit about two of the models, hospital utilization and influenza immunization logic models. We'll go over the one-pagers we went through, and then Linda did help us out with kind of refreshing those and putting them in a different perspective. So we'll go over her iterations of those one-pagers. And then I think we have enough people. We'll do some breakout rooms and have discussions on how we think the hub can participate within those projects, the logic models. We do have a few engagement opportunities to share with you all, and our meeting after this is October. Actually, it isn't. We will go through, I just realized we'll go through rescheduling the next one because there is a Jewish holiday on October 6th. It's Yom Kippur on October 6th. So we'll look at rescheduling that meeting towards the end of this one. So we'll do our check-in question. Let us know your name, where you're calling in from, and if you could learn any new skill, what would it be? So I'll start off. My name is Laura Jackson, and I am calling in from Eugene, Oregon. If I could learn any new skill, I think I would learn to play the piano. We have a piano here, but I don't know how to play it. I would love to learn to play the piano. So I will pass it off. The top of my list is Anthony.
My name is Anthony Sanchez. I don't know, a new skill. figure out how those universal remotes work. That'll be my new skill. I already know the piano, so I'm off to the remote.
Perfect. Yeah. Once I learn the piano, move on to the remotes too. Thank you. Thanks for coming, Anthony. Linda.
I'm Linda Dreyer and I'm in Portland, Oregon, and I would like to learn a new language.
Any particular language?
Well, I think Spanish would make the most sense. And I have a couple of college years of Spanish behind me, so that might be the best choice.
Yeah, you've already got a kickstart on that one. All right, thank you. Chris Morgan.
Hi, I'm Chris Morgan. I'm from Hayden, Idaho. If I could learn any new skills, I think it'd be longer endurance.
That's a good one.
Better build up my strength where I could, go longer, I guess. So.
Yeah, that's a good one. Thanks for sharing. Thanks for coming. Chris Syverson.
Hi, Chris Severson. I'm in Reno, where it's absolutely beautiful. And it's funny, Laura. The first thing that popped in my mind, one of the things I've always wanted to do is learn to play the saxophone. And it's like a totally useless skill at this point in my life, but it's just one of those things that I've always thought if I had time and energy, I would learn to play the saxophone.
I love that. Saxophone is so fun too. D.
I'm sorry, did you say D?
Yes.
Okay. Well, I was going to, pile on to the language thing. I'm using Babbel, by the way, to learn Spanish, and it's very, very good. So I guess I'll take that off my list and say, I really want to be able to scuba dive.
Oh, yeah, that's a good one. That's up there too. Thank you. Lindsay.
I'm going to go with the language too. I'm with Linda. I would like to be, I guess, fluent in Spanish. I've started using Babbel. I started that at the beginning of this year and haven't been giving it too much attention. So I think that is the skill that I would like to learn. Or I could join my son, who he's 10, and they are learning German in school right now, which that was very interesting. So he told me all of the greetings when I picked him up from school today. So yeah, become fluent in a new language. And I'm Lindsay Galley. I'm the Director of Education at PSCC Partners, and I live in Sacramento, California, where it's going to be over 100 for the next foreseeable future.
Thanks, Lindsay. German, that's so interesting.
He said, "Isn't that cool?" And I said, "Yeah, it's cool. It's just random."
I was thinking.
Yeah. Why German?
Yeah, is that like bad news for us or what?
I don't know. We'll see. I'll let you know. I'll keep you updated.
All right, thank you. And Katie.
Hi, everyone. I'm Katie Frazier. I'm in Portland, Oregon. And right now, the most useful skill I could have would be being a better student as I prepare for exams. I'm not a diligent studier, so I would like that skill.
Study skills definitely are important and hard to have. All right, so just checking if I missed anybody. Don't think I did. We'll go ahead and move on. These are our hub meeting agreements. So I'll just go through those. We go through them every meeting. So make this meeting a priority. We do open the meeting 10 minutes prior to start. You're more than welcome to join us and hang out before the meeting. I will provide a rough estimate of how long we'll spend on each agenda item ahead of the meeting. That's all within the agendas we send out. Also provide context and discussion questions prior to the meeting. Parking lot will be used to table agenda items if you have any ideas for future meetings. In a group discussion, participants will use the Zoom raise hand function if they would like to contribute to the discussion. Our meetings are recorded and summaries will be shared after the meeting. If you have any concern coming up during the meeting, please feel free to private chat either myself, Lindsay, or Katie. We'll help you out. All right, so we have the the logic models, intervention logic models. We figured we'd go through them slowly and do just a few models throughout these meetings. So Katie, Lindsay, and I put together one-pager versions of those long logic models we had sent to you a few months ago, just so that they're all in the same format and hopefully easier to read. And like I mentioned earlier in the meeting, Linda graciously made it even easier to go through and understand the logic model. So what I think we'll do is I will show you, we'll go through the one-pagers we put together and then the one-pager that Linda put together. We'll talk about those and then we'll go into breakout sessions and do our discussions about with the two questions we have here. So as we're talking about the logic models, think about what identified activities can you all as advisors partner with staff on to reach the outcomes and impact, I can't talk today, and what additional opportunities are for advisors, you all, and the hub, you all, that have not been called out. So I'm going to share the first one. Let's start with the influenza vaccine logic model. So the goal of this one is to improve influenza vaccinations for Medicare beneficiaries. The identified activities they have are to establish who our primary partners are and document in the CRM, contact state pharmacy associations, create a plan for contacting pilot pharmacy sites, create pharmacy pilot project plan, meet regularly with pharmacies and offer remote TA, facilitate PDSA with pilot sites, promote resource on webpage through the newsletter, review and update AWV toolkit, develop a podcast project timeline, research content, draft script for podcast, find speaker, record, and promote the podcast. And then test a change in certain community pharmacies. So that's a lot. They have their short-term and long-term outcomes over here on the right. Thank you, Katie. CRM is customer relationship management, a software they use to track their interactions with clients. And AWV is annual wellness visit. Thank you again. Chris.
Just one more. I'm really bad with acronyms. On the next one, there's an ALF. What's
Do you know
ALF?
what that one is? ALF.
Yeah.
I think that stands for assisted living facilities, but that's just a guess.
I think that's a pretty good guess.
Yeah, I would say that's a good. I just Googled it too. And it also is an abbreviation for acute liver failure, but that doesn't make sense in context there.
I think a lot of ALFs contract with pharmacies to come on site and do vaccinations. So that's what I think that was going.
Yep.
Yes, that's correct, Linda. Thank you.
And I think that's a good note for us to remove the abbreviations and spell things out.
Yes.
Chris, so thank you for raising that.
So Any other questions or comments on this version of the one pager? Is it, if you've read the full logic models, is it easier to go through aside from the the abbreviations, of course? Let's look at the one Linda did. Linda, do you want to talk a little bit about your process?
Well, logic models have been around for a bazillion years. And this is the old version that I learned to use a long time ago. And it's based on the logic of if then. If, for example, the influenza team completes those activities, then they can achieve the short-term outcomes in the middle column. And if those short-term objectives are achieved, then probably the long-term outcomes can also be achieved. And the impacts could be expected. So for me, it was easier to divide the logic models that we got into these three columns and use the if-then as a way to try to work across them. I think we have to struggle a little bit about where the team is actually going with their intervention plan. To me, this looks like they are going to really zero in on pharmacies. And so for us to find a home in some of their activities, I gave it my best shot. And I thought maybe when they look at the annual wellness visit vaccine check, I think that's, where the primary care provider would be asking us what we've done around vaccinations in general. Maybe we could provide some feedback to how those questions are worded. Maybe there could be some changes in making them more user-friendly. I think we could also, if they are going to distribute materials to the pharmacies and to the assisted living facilities, maybe the hub could provide some feedback on the content and the design of those materials. So these are just some ideas off the top of my head. And I'm hoping it makes sense to the rest of you, but you'll have to let me know.
Thank you, Linda. Katie?
This is really helpful, Linda. Thank you for taking the time to put it in this format. And I just have a question for everyone. Do you see an opportunity to be like a potential interviewee on a podcast? I don't know exactly like the plans for the podcast, but maybe I was just thinking like getting vaccines at a pharmacy versus having to go to your doctor, or what might make it better for you, or why engaging a pharmacist is meaningful to you as a potential opportunity.
Well, I do, because we're the people that they would like to direct to pharmacies for immunizations. So the more the pharmacies can make that acceptable to us, the better their chance for achieving their objectives. But again, we don't have enough information about what their plans really are in terms of content for the podcast.
Yeah, exactly. And I think they might not even be thinking of it as an opportunity, but if we take that back to them saying that it is, they might think of it. think of a way to incorporate it.
I think that's a good point. I think that's the opportunity here. So our plan is to bring all of these ideas to the teams that are working on these logic models. Because at this point, they know that they want to engage with patient family advisors with all of you with the partnership hub. So our thought was to kind of help them through that process. So whatever ideas that we come up with here today, we're going to bring those to the team at the end of this month. So I think we can get really creative with this brainstorm and how or where we see ourselves as patient family advisors within these. So we can say, you know, I see that you have the idea to put a podcast together on what if you interviewed some of the patient family partners. So I think we can, within some of these activities, help them brainstorm by providing ideas directly from patients and families.
Thank you. Chris. Oh, both Chris's. Chris Severson first, I think.
Just a really quick, I don't even know if this is an appropriate place to put this, but if there was some sort of grant or incentive that we could or coupon where they could go to the pharmacy and get it for free. I think once you get them in that mode of going to the pharmacy and getting your immunization, I think they'll do it again next year. You know, it's getting that first time there. And so if there was any kind of incentives, if you could work with a pharmacy, because I think it, especially the pharmacy I go to is in my grocery store. So I'm there already. But if, you know, if you could get the pharmacy to pick up the cost, it brings people into the store, you know, so there would be an advantage to have people in their store. So just a thought.
Thank you.
This is Dee. I'm sorry. I can't find the hand raise button. Maybe I'm missing it down here. Is it in chat or participants or where is it?
Down at the bottom of your little menu bar, I think if you click more, there's it says reactions. You can
reactions. I see reactions. I'm sorry. Okay.
Yeah, no, that's okay.
I'll raise my hand there.
Perfect. We'll go with Chris Morgan and then Dee.
Okay.
Yeah, the grocery store, you know, pharmacy thing would be a good idea, but you know, vaccination thing is kind of shaky right now with everything coming out with the CDC. So things that, so I don't know.
Yeah, it's important to think about. Thank you, Chris. All right, Dee.
Let me see. Yeah, I was just gonna say, you know, one of the places that I see bombarded and they have really good service and they move the line is Costco. And in fact, I'm using them regularly for everything because they're so much better and cheaper, you know, even on the copay with insurance. But the other thing that I'm using them for right now is they have a whole program for travel immunizations. So I guess what I'm asking is, would you want me, I have connections, would you want me to talk to the Costco pharmacy folks or no? I mean, I just need some direction about what you want me to do specifically, I guess is what I'm saying.
This is Katie. I can try to answer that, Dee. I think we have very prescribed guidelines by CMS on who we partner with. So I'm not 100% sure if Costco is one of them, but I will work to find out and get back to you. And then if that's a opportunity for a partnership, we will definitely connect you with the team to build that bridge.
Great, because I think they reach a lot of people with a lot of time. And you know, I've switched from Safeway to them because it's much better for me, but let me know.
Awesome. Thank you, Dee.
Thank you, Katie. So any other ideas on identified activities where you all can partner? So Linda gave these wonderful examples. Is there anything off of these ones or with any of these other ideas that you think would be a good place for you to partner to reach the outcomes and impact? Our second question was, what additional opportunities are there for advisors and the hub that have not been called out? So is there anything not listed here in the activities already that you think would be a good place for you all to participate and partner? Kate?
Yeah, it's not listed, but I was thinking a lot of people receive their medications in the mail, like via mail, like on a regular subscription. So if like those pharmacies who mail them out can say, hey, I noticed you live close to this location, and give them information on where they could get their vaccines at pharmacies close to them, or some sort of like information for Medicare beneficiaries to just know that you don't have to go all the way to your doctor to get your vaccine. Here's some other opportunities.
That's good. Then I know there's sometimes like door-to-door vaccines for people who can't necessarily leave where they are. So that's a good place too. Anyone else?
Oh, this is Dee again. I just want to know what it means to find a speaker.
I think just in brainstorming the podcast idea, who they might want to interview on a podcast. So a potential like pharmacist that's been successful in administering vaccinations in their community, or perhaps a Medicare beneficiary that has done it and their experience. I mean, I think there's a few opportunities, but yeah, I think it's open right now for ideas. They're probably just brainstorming all opportunities.
Yeah,
Thank you.
I think these all kind of go under the develop a podcast project timeline. Any other ideas?
I do know up here in Hayden that they do at the Medicine Man pharmacies. A friend of mine does go to nursing homes and dialysis centers to administer the influenza shot. So that's one thing that they're doing.
That's a good place. Yeah, thank you.
Yeah, so maybe there's an opportunity there to capture best practices in there and how they address where they go and when they go to reach the largest population.
And oh, hi, Ashley. I see that you have joined us.
Sorry, I was stuck in pickup line for kiddos. So.
No problem.
Yeah, I'm trying to figure out what the outcome is, so I'm a little quiet because I'm trying to put myself in here. So
yeah, no problem. Do you have any specific questions? Yeah.
What is this? I mean, I get what it is. So is this I'm sorry, is this let me be more specific. Is this a project then that a team is working on with the eventual outcome or goal of improving influenza vaccines in Medicare populations? Is that correct? Okay.
Yes.
Okay. Thank you.
Yes, that is correct.
Yeah, and we're just looking for, so this is the activities that the team has laid out. So within these activities, and knowing that, you know, their goal is to really focus on pharmacy or pharmacists to administer those vaccines, knowing that they're in the communities, it's an easy place for people to go. But so just brainstorming and thinking creatively of how we might be able to support this team, or what other ideas that we have that could support some of those activities, and where can we partner. So we've talked about, or you see, Linda has worked on this redraft of it, so we can provide feedback on their annual wellness toolkit for a vaccine check. Other ideas were, you know, can one of us as a patient family advisor be interviewed for the podcast that they would like to do? Can we review other materials that go out to the community that promote, you know, going to your pharmacy to get vaccinated? So other creative ideas is what we're brainstorming now.
I guess my question would be, is there anything in here to address those that don't have transportation to these sites? That would be the first thing. And then, you know, I know pharmacies, as far as being convenient and everywhere, but are there any ideas around doing, and I think somebody had mentioned this on the outreach piece, like local community centers and things like that, as well then as the pharmacies? Is there any ideas to partner with like Roseman University School of Pharmacy? I know they used to do outreach events with their student pharmacists where they would actually go to skilled nursing facilities and those areas to what they called brown bag lunches, where the residents of assisted living homes, skilled nursing facilities would bring their medicines, and the student pharmacists would just make sure that they were taking them correctly, that they understood what it was that they were taking. Are they taking them the correct dosage? So maybe there's something there where that type of outreach could complement that, or partner with Roseman to do something along those lines, or any other. I mean, they're the only pharmacy school in the state, unfortunately, but something like that.
I like that, reaching out to the schools. That's something we talk about in some of our other groups, is reaching out to medical students with experiences of patient family partners and things like this. So
yeah, I mean, I just remember the massive COVID clinic at UNLV, right? And I guess maybe because I had such personal ties, because a lot of my pre-med, pre-PA, pre-pharm students were there, getting trained and administering all the COVID vaccines. And we had a ton of students from Toro and the med school, the dental school, even the nursing programs here in the state that, you know, are capable of doing that. So maybe some type of coordinated outreach effort. I mean, heck, if you want my pre-meds and my pre-PAs, if somebody wants to train them, we'll send them out. I mean, they need the experience anyways, right? So I think partnering and being strategic about those populations that already exist in these areas and around the schools could potentially be something that they could tap into as well.
thank you. Yeah, it's great. All right, any other thoughts or ideas on the influenza vaccine model and we'll move over to the hospital utilization one?
This is Dee again. I'm sorry. I don't know what this hand thing, but I just wanted to ask the team, has anyone reached out to their local or their state senators and congresswomen, congressmen? Are we working with any of them? Because I know Patty Murray is somebody that I can approach. I know her, but you know, that's my senator, you know, one of the two senators here in Washington. Is that worth trying or no? I mean,
So as an organization, we do reach out to political people, either one to help assist us in getting the funds and the money to do the work, or to just endorse us. But I think this work specifically comes from the Center for Medicare and Medicaid Services. And so they provide us some pretty specific goals and things that we need to achieve. And I think, I mean, if it's an opportunity to partner with your senators and people in your state to connect you with communities that we might not be in touch with, I think that is an opportunity, but I don't know that their level of impact is down to this granularity that we need to be paying attention to. I don't know.
Okay, thanks.
Thank you, Katie. All right, we'll go ahead and move on to the hospital utilization. And I'm just going to go straight to Linda's because I think it's easier to read than the other ones. So what I'm going to do is in the chat, I put a link to a Jamboard. It's called a Jamboard. And you can, there's the questions that we asked earlier on the Jamboard. And you are more than welcome as we brainstorm this one. You are more than welcome to add your thoughts to the board. So the way you do that is by just clicking the sticky note. You can put your ideas on that sticky note and press save. And it pops up on the board. And that way we have all of our thoughts and ideas written down for this next one. So thank you, Lindsay, who was capturing everyone's brainstorm for the last one.
Yeah, and Laura, I'll put the link. So we have, like Laura said, another board for the immunization, the influenza immunization logic model. So I'll put that in the chat too. And I think after this meeting as well, if more ideas come up, we can leave those open and you can continue to put your ideas and brainstorms for each of these logic models in there. So I'll put them in the chat.
Thank you. All right, so yeah, you're already getting ones. So this one is the community hospital utilization logic model. So they have these activities like identifying and working with projects and internal subject matter experts that align with the drivers of high hospital utilization. And Linda thought we could ID hub members as subject matter experts, collaborate with SMEs. Katie, if you could do abbreviations for me, or Lindsay, to identify the topics for the webinars, and you all can collaborate on those topics, launch community collaboratives, and hold bi-monthly meetings with partners from the Comagine states. And have members, you all can help put patients' perspective into those marketing materials, which is always very important. They have more activities like community collaboratives, bi-monthly educational webinars, webinar speakers share best practices. So you all can participate in a panel for those webinars, communicate community readmission reports to collaborative and webinar participants. So those are just some ideas for activities. Their outcomes short-term are all here: attendance at community collaboratives. Oh, you know what? I'm so sorry. Let me get the goal for this one is to reduce 30-day hospital readmissions and reduce energy, I can't read either today, and reduce emergency department utilization through the use of community collaboratives and online resources. So that is the goal of this one. I have too many things here. Okay. We'll start with Chris.
I just wanted to say thank you for going back to that, because in reading the logic model, I wasn't understanding what the goal was. And when you put in the readmissions, to me, that changes the whole flavor of it. So I would say something in here on this sheet to focus on readmissions, because it's not just admissions, right? This to me was just on hospital utilization. It didn't say anything about readmission.
Yes, thank you. I'm going to add that on this sheet so that we can all have it in front of us. There we go. It's right here for you. All right, we'll look over at our Jamboard. We have webinar participation as recipients of care, join the community collaboratives, collaborate on topics for the webinars, so in the planning, hub members as subject matter as experts, and to help put patients' perspective into marketing materials.
I was
Lindsay.
just grabbing the ones that Linda highlighted on there. Capturing them.
Chris?
So I am on the Nevada Community Board, and readmissions in Nevada was a really hot topic for us a couple of years ago. And we did something similar where we looked at what we could do to help reduce it. And we had subgroups. So for example, we looked at, what was the home life? Like, was there a support at home, or was there community support that could help them stay at home or help them not get readmitted? And so I don't know if you want me to do it, but I can go back, or somebody can go back and look at the work that we did at the Nevada board. We also worked with, I think, REMSA to see if here in the North, where they could do checks on people to help reduce the readmission. So if they're out and about and they don't have any calls, they can do sort of well checks or follow-ups, because oftentimes people are discharged from the hospital and they don't have the means, or they don't know how to get back for follow-up to get to their doctor. So if we could help in that area, that would be a big.
Can you say again who would do those well checks or follow-ups?
REMSA, which is our ambulance paramedic here. I know that they had a subgroup of the Nevada board that looked at avenues for follow-up to help reduce the readmissions.
So that could be a great webinar to promote some of those best practices. I'll call on myself, Laura.
Oh, I thought that was up from last.
Oh no. I was just thinking, and Anthony, you might be familiar with this from another contract that we're working in. We have been really focused on hospital readmissions, and one of the things that really kick-started the work that we were doing was simply talking with patients and families about what did they need when they went home from the hospital, or what did they not have when they went home from the hospital, and I think, Chris, you were kind of talking along these lines too, just to identify what were the barriers. And I think, conversations like that alone, and maybe, we could help put on a panel of patients and families to talk about, being discharged from a hospital and the resources that we needed, I think could be really powerful too.
Sure.
I'll put that on the Jamboard.
Okay. Great. Any other thoughts about where you all can partner with staff?
Oh my gosh, Linda, and I'm just seeing that highlighted comment at the bottom, which is just what I just said, a panel to share their experiences. Good idea.
So I can make it a little bit smaller so you could fit. Or not. All right, how about for that that second question, and again it's on the Jamboard, what additional opportunities are there for advisors and the hub that have not been called out yet on these? Anything else? Katie?
Yeah, I don't know if this is an opportunity or not, but I was just thinking of, it would be great to do some sort of like brainstorming or collaborative activity with all of the advisors as to like what resources you know are in your community. So if you know of a number you can call for an air conditioner, or various things that might prevent you from needing hospital or urgent care, just different things to think about, like if you all are on different committees or working in different areas in the community that we might not have access to or know about, to just include in our resources.
Thank you. Anthony, any ideas?
I'm a little lost today. What Lindsay said is the best thing. There's already established plan for exiting the hospital. I forget the correct terminology she used. They need to make sure that they understand the plan that's given, and then someone here in New Mexico, when you get discharged, the nurse for your primary care is going to call you within a few days, and you're going to see your primary care. So I'm not, unless they don't have primary cares, I don't really understand why they're not being followed through. Mine does that all the time. They're actually given a list, and they call all the patients that got discharged, unless the patient just refuses to go or doesn't have that established primary care doctor. And if that's a big problem, then that needs to change, because then they're leaving the hospital without any follow-up to begin with. I heard about the paramedics. I heard of something similar to that over here in Mexico, but I don't believe that's still happening here. So there's probably other systemic issues that are causing that, besides just the patient not wanting to
Oh, yeah.
care for themselves.
Right.
Definitely. I think it sounds like your facilities have some ideal practices that would be good to share in those webinars or panels.
Yeah, I know everybody's different. I was
Right.
just wondering, is that a giant problem that the follow through after discharge in other hospitals? I know everybody's different, but
Mhm.
I mean, New Mexico is not that big of a state. There's much bigger hospital systems that should be doing similar things already.
I don't know. It's like you said, everyone's different. So it could be a big issue in some places. And I think that's something, sharing what your facility does. That's why it's important to do that. Thank you, Anthony. Any other additional opportunities?
There's a great one just added to the Jamboard to drill down into research and data to identify populations most likely to be readmitted, and have focus groups around, what resources they need, why they go to the ER. That was there's definitely opportunity for the connection to hospitals, or learning from patients and sharing that with the hospitals.
Mm-hmm.
And looking at, what is that? What does the discharge process look like? Is the information at a level of that people would be able to understand when it comes to health literacy? Great idea.
Mm-hmm. All right. Any last minute thoughts or ideas about these two logic models? Nope. Alrighty then. Well, thank you all for sharing your ideas and sharing on the Jam boards and in the meeting. We'll take these to the teams and hopefully come back with engagement opportunities for you all very soon. Speaking of, we have an engagement opportunity from the SQI team, and I will pass it to Katie to talk about it.
Thanks, Laura. Yeah. So on Tuesday, September 27th, Lindsay, Laura, and I have an opportunity to present to a captive system-wide quality improvement audience. And we wanted to capitalize on this opportunity and invite one or all of you to participate, present, and or just attend. We're hoping to share with them kind of what we've done so far, projects that we've partnered on, how that partnership went, what the opportunities for improvement are, what the positive feedback was, and then reinforce the staff process for engaging advisors on this work, and then talk about kind of what, like the exercise we just went through. So sharing back advisors' ideas on how staff can partner. So if this is of interest to you, to attend and or participate, let me know. We can work together offline to ensure you're able to do that. And I'm happy to answer any questions.
Go ahead, Chris.
I just was gonna say, I think one of the best things that I've seen is this logic model that Linda helped put together, and I think that might be something that would be interesting for the other groups to hear for in that presentation, if Linda would feel so inclined. Volunteering you, Linda.
I don't know how I would fit into it, but thank you for the show of support.
I definitely think that's part of it. You know, we want to share with them our discussions that we're having here, because these are the teams that will be working on these projects too. So yeah, I think it could be powerful to help them, you know, realize where the opportunities are.
You think it would be like a demonstration of the hub looking at something and working with it in more detail and then bringing it back?
Yeah, that's a great way to kind of present it. I hadn't really thought about it that way, but yeah, you're right. To demonstrate, you know, how all of you can take ideas or materials and transform them into something that everyone can understand and use. It's a great idea.
Do we need to register for that thing? I'm sorry. On the 27th?
There's no registration, but if you're interested in attending, just let me know and I'll be sure to get the invite to you.
I'm letting you know.
Awesome, thanks, Dee. And I think, you know, it's open on how an advisor can be a participant on this. And I mean, staff might even have questions of you of how to engage, how to interact, at what level, how, at what frequency, you know, just questions that might be better answered by you all as advisors than me being kind of the intermediary.
Thank you for sharing, Katie. We're excited for that. Yeah, and if you are interested, let Katie know, and we'll see you there. The next thing is the chronic kidney disease flyer. If you all remember from a few weeks ago, I guess, we had one of the Comagine teams come to us with a chronic kidney disease flyer. You all sent some really fabulous feedback to them. I'm going to just pull it up. And they have come back with, they have come back with a finalized flyer. I did send this out in an email probably last week or the week before. And so this is the result of all of your feedback. So thank you all for sending that over. In the follow-up of this meeting, I'll send this out again, and you are more than welcome to take a look at this flyer. They did some, I really enjoy how they did the QR codes so you can find more localized information for your state. And then lastly, like I mentioned at the top of the meeting, we will be rescheduling our next meeting because of Yom Kippur is on that day. So these are the dates that I have that are within that week or early the following week. And I'm going to pull up a, Lindsay, can you pull up the polls? It doesn't. It says I'm logged in from another device. You're pulling.
Yes,
Okay, cool.
There you go.
Thank you. I can't see it, but I assume it's up.
Yeah.
If you could choose, you can, it's multiple choice, so you can pick, or you can pick as many dates as you're available. So if you take a moment to do that, and we'll get a new one, a new meeting just for this next meeting. After that, we'll go back to our regularly scheduled meeting.
Got 7.
8, 9, yep.
Okay.
Is there one that most people vote for?
Most for Monday, October 3rd.
Okay.
Except for one, whoever that is. Sorry.
All right, we'll get that information in and send out a calendar invite for that one on Monday, October 3rd at 3 p.m. Pacific, 4 p.m. Mountain. And that is all. If you have any questions, feel free to email me. My email is there on the screen. Katie and Lindsay are also available if you have any questions. And I didn't put in, that's today. Well, thank you for joining us, everybody, and we'll see you October 3rd.
Thank you.
Everybody.
Thank you.